I am Professor Jayanta Panda, Head of the Department Medicine at SCB Medical College, Cuttack, Odisha, and Chairman of API Odisha State Chapter. The COVID-19 pandemic has shaken the whole world, and after the storm, we got lot of presentations related to the viral prodrome. It may be obesity, it may be asthenia, it may be a episode related to hyperglycemia, dyspepsia or insomnia. We called it long COVID or post COVID, and in the process many people were detected hyperglycemic after the COVID, and we termed them new onset hyperglycemia following COVID, and nothing is known about them, whether it is because of ILITs, because of this novel coronavirus, or it is related to stress, steroid, obesity, antivirals, and what is the future? Are they going to continue with diabetes, or it's transient, they'll be back to the normoglycemia, or they'll have a different form, insulin requiring or different type of diabetes. So my presentation in the APICON 2022 was related to new onset diabetes in COVID and how do I approach. So when after the COVID we get a hyperglycemia, we establish the diagnosis, start with the insulin when the patient is critically sick in the ICU, semi-ICU or the ward, and then followed with oral tablets, lifestyle, and we have seen what ends the episode. And in the process, we have taken more than 500 patients and followed them for almost 1.5 years and seen what is the fate of those patients, of whom most of the patients have turned normoglycemic in a span of 6 months, and few have continued as type 2 diabetes. And they have very well responded to oral drugs, few with insulin where blood sugar was more than 300, and with proper control of blood sugar and the related complications, they had a life which is completely comfortable. With this, we can conclude that it is just another type of the type 2 diabetes where the pancreatic beta cells are affected either by direct ILITs because of the virus or because of drugs like antivirals and steroid, and the people require antidiabetic treatment, oral or insulin, for quite some time, and with lifestyle and the drugs it's easy to control the hyperglycemia. And if we detect in time, control the diabetes, we will be able to manage them very well. Thank you all.